AI can be deployed in a lot of different spaces across dental to be really helpful. So I think it's become a very, very loaded term.
One of the things that I've noticed inside of dental too is that, and it's true everywhere, right? We hear AI all the time. It's like AI everything, right? Everything's AI. Not everything is AI. And sometimes we're further along in certain areas, and sometimes it's smoke and mirrors. Like, it's like, no, that wasn't AI. That was somebody pushing a button back there, right? Like, what are your thoughts on AI and where we're at with that inside of dental?
Yeah, AI, artificial intelligence, become this loaded term, to an extent, right? First of all, most people don't know the difference between AI, machine learning, computer vision, right? Natural language processing. There's actually a few different types of technologies. Secondly, I think because of the rising of radiographic diagnostic assistance, everybody in dental has been sort of trained due to marketing to think the minute that they think AI, they think image recognition on in a
Yeah.
radiograph, and AI actually can provide a lot of different functions, from analyzing your chart data to analyzing your call data to analyzing your office operations and telling you what is the best decision, right? Or even how equipment is functioning on a day-to-day basis. AI can be deployed in a lot of different spaces across dental to be really helpful. So I think it's become a very, very loaded term. Within image, within the AI that we all think of, right? Radiographic diagnostic assistance is exciting to see. Right, you've had the rise of Overjet, Pearl, Video Health, Denti AI, and a wide variety of others, that have come out and looked at 2D radiographic diagnostic assistance. You're seeing now FDA approvals start to come through, which
Mhm.
is exciting. There are some DSO and insurer relationships that have evolved, which are starting to connect the right pieces between the patient, the payer, and the provider. So
So
that's
walk through
interesting.
that. Touch on that. So that's like, is that like when I go to my insurance, for my home insurance and my car, and they're like, "Hey Gary, if you put your home and your car here, we can actually give you a discount because we can protect you better or whatever." There's reasons and laws around that. Is it like that, or is it a little bit different than that?
Yeah, insurance is an interesting example because they have some carriers have multiple different types of policies. I almost even taking it a step higher level, because I think it's still pretty young and early in dental. It's more along the lines of, if I come into a dental, we do this crazy thing in dental offices. I pitch this business model sometimes to other people without calling it dentistry, and they think I'm really crazy, right? And then I tell them I'm a dentist, and and then they really feel bad, right? But I tell them, hey, look, we have customers that come in. We provide some procedures, on them. They typically pay us for those procedures. We're pretty sure we're going to get that reimbursement. And then we tell them, we pitch them on these other, 3, 4, 5, 10, 15 things, whatever the patient needs. And then we send them away for 2 to 3 weeks while we figure out, how much their insurance is actually going to pay, where they're at in their accumulator, what's actually covered or not covered, how we're going to process these claims, what system is going to be best to have them pay on, right? We send them away while we figure out all these pieces, where we're going to schedule them in and with who, and then we try to see if we can get them to come back in 3 weeks, right? Instead of right, getting the patient going at the point of care, right? And
Yeah.
and that just doesn't really make much sense. So where I see AI coming into play is, if the insurers, for example, the payers, can get enough confidence around the AI and its algorithms to trust it, then maybe we can have some blanket prior
Mm.
authorizations here, right? Maybe we can say that, hey, the AI is calculated, this is going to qualify for SRP, scaling root planing, in X quadrants, right? Or that is, that carry has extended to the point where we are going to cover, the filling or the crown in this case, or there is
Wow.
clearly widening of the periodontal ligament and, and/or an infection, at the bottom of the tooth at the root. So, this is clearly going to be covered for root canal therapy, right? Can we gain enough conviction around the AI to trust it to make maybe not all the decisions, but some of the decisions on the spot? So that if we have, like we previously talked about the RCM bits, if we are able to automate the insurance processing, the insurance verification and claims processing, and we have the AI deployed to give us that prior authorization, then maybe we can actually run the process through in a zip, and not have to send the patient away for a few months. So I think if these technologies can kind of come in and work together, and enough of the right stakeholders can gain confidence around them, it could be a much better experience for the
for
patient and the
everybody.
practice.